Sir, in mastectomy, there is a risk of seroma formation, so we are putting a seroma drain. But in
we are putting suction drain.
suction drain. Sir, but in breast conservation therapy, I have seen no patient till now.
That's a good question.
Drain.
You see, when we do extremity dissection, we put a drain. A lot of people feel that even that is not required. And we keep it, when this patient had a drain, this is breast conservation surgery, we have a drain. But drain is not mandatory. If I have obliterated the cavity properly, like you saw the round block mastopexy the other day, then we may not put a drain. But if you've done an extremity dissection, it is better to put a drain so that you get a, you don't have seroma formation. So seroma is a sequelae of surgery.
Yes, sir.
It's not a complication, it's a sequelae. If you leave a cavity open, cavity throws serum. Serum is collection of, seroma is collection of serum, which is that the cavity is weeping. But if I have packed it, then we don't have the problem.
Don't have to go.
The other thing was, what were you asking?
So in thyroid also we put the thyroid surgery is also for the same reason we put the
section is being done. What was the other thing?
varicocele.
Oh, that patient.
Yes.
Yes, sir.
Varicocele usually happens due to pampiniform plexus getting dilated and tortuous. Varicose veins are dilated and tortuous, saphenous, great saphenous veins. You know that. So basically, when the veins become longer, there is no space. The space is limited, so they have to coil like a snake. So the bag of worms, kind of a feeling in the scrotum. That's what is varicocele, loosely speaking. The patient will give you a dragging sensation, some discomfort, because it's got some weight, so it's hanging down with some weight. But if you allow it to stay, this discomfort can become more discomfort, and later on you can have, massively dilated varicose veins. Varicose vein is also a inguinal swelling sometimes. Otherwise, mostly it is closed. You may also find cuff impulse. You saw the Valsalva maneuver.
Yes, sir.
That was possible.
So the Valsalva, you do it, it starts ballooning up. And the other sign I showed you was a bow sign.
Bow sign.
When you ask the patient to bow, the swelling disappears or reduces. Because it's emptying into the intra-abdominal. The intra-abdominal pressure is what takes care of it. So there is no, these are few clinical signs. But usual history is what I've told you. And on examination, a bag of worms, feeling of a bag of worms. What will it do over a long period of time? Pain, discomfort, patient will have trouble. And also the temperature will rise locally, which may affect the spermatogenesis adversely.
Yes, sir.
So the patient may have
Infertility.
infertility, and that is what the patient came for.
Yeah.
And that's why he mentioned, I'm not planning a family now, I'm planning it later. But if the counts drop, it can remain like that for a long time. So we need to investigate them with the same thing in mind. So these are the symptoms and the signs I told you. Feeling of bag of worms with Valsalva bulging and bow sign.
And reduces.
Okay. Confirmation is done by using ultrasound and Doppler. And as he mentioned, during Doppler or the ultrasound they were doing, Valsalva test was done. Because in Valsalva it will distend. That ultrasound will see even better. And then you can grade them. There are various grades, of course that's more academic. But depending upon the grade 1, grade 2, grade 3, you plan the therapy. Initially you change the lifestyle, you advise lifestyle changes only. Scrotal support, active exercise, don't make them sleep and sit too long. And counsel them that it may not be immediately that the sperms would be affected. And remember, left side is more common than the right.
Because left vein is longer than
One, yes.
and right. Left vein drains at right angle to the renal vein,
Left
or
renal
right
veins
drains.
are longer.
Yes.
What? Because the right renal vein is low, so the distance it has to travel is less. One. Two, the left side also has sigmoid, which sometimes causes compression by virtue of its weight. And three, the left side opens right opposite where the I mean, it opens into the renal vein.
Renal vein, while right side opens in
Right side open to the
IVC.
inferior
IVC.
cava directly.
Yes, sir.
So it doesn't require that length. Here the length is
Longer.
longer. And then where the spermatic veins open, just opposite that, the vein coming from the adrenal is opening, which drains what? Epinephrine.
Epinephrine.
And that causes the spasm.
Vasoconstriction.
So it closes.
Okay.
So these are the 4 reasons why left is more common than right.
Right. Yes, sir. Yes, sir.
Longer,
Longer.
pressure of
Pressure
sigmoid,
sigmoid
3,
drains directly
open
into
to the renal
the
vein and angle,
and
5, 4,
epinephrine coming.
the suprarenal vein also drains opposite. Are you retaining?
Yes.
Yeah.
Yes.
Now, they need treatment first in the form of lifestyle changes, scrotal support, active exercises. 2, they can go in for sclerotherapy, which is an option, interventional, or they can inject, cannula into the vein, and finally, sclerosants are given. Various sclerosants are available, which will block the drainage, but that can sometimes may not be effective because the bag is already there. And then you have a laparoscopic approach where you clip the spermatic veins. So this is all disconnection, but the symptoms may remain, dragging sensation. The other is an open technique, where we open up through the inguinal route, transinguinal, which we showed the other day, the varicocele management.
Yes, sir.
So why is it taking long to do? So where we take out dissect out the spermatic veins, that whole thing, plexus is dissected out. We clamp it on both the sides, cut it out, and then bring it up. So by hitching it up, you're reducing the bulk in the scrotal region. Symptomatically, patient feels better. Some people also put a cremasteric hitch. They take a bite through the plexus after disconnecting and hitch it to the cremaster so it doesn't hang down. These are various methods. Okay?
Okay.
Some people also do scrotal varicocelectomy. That is, they go through the scrotal route and they multiple plication. Basic aim is to disconnect
Reduce.
the flow back,
Okay, sir.
and second is to reduce their bulk. But we should take care when we are separating in the inguinal region that you separate out for any hernia, the sac being there, and the artery to the vas. Blood supply is very important. Because in doing so, if you cut off the blood supply, your testis might undergo. Although testis has dual blood supply, one directly from the aorta, the other is
The testicular.
testicular artery. So you may damage this, other one can still be. Okay?
Yes, sir.
Any question?
No, sir.